Okay, so we are going to be looking at an introduction to head and neck. So why are we looking at the head and neck? So when we are talking about the head and the neck, these are special, it's a specialized region of the body that contains the brain, and you find some major sensory organs and the beginning of the respiratory, the digestive system, and it's in this head and neck that we're going to find some important blood vessels and nerves. So it is one of the most anatomically complex regions because many vital structures are packed into a relatively small space. No wonder we have to know exactly what head and neck is. So this will be one of the components of our anatomy that we're going to be looking at this year. Okay, so to begin, we can first look at first. So I want us to first try and look at the functions of this head and neck. So as we said, you find that it houses the brain and some sensory organs. So it is responsible for protection of these organs. And you find that it also houses organs like that are responsible for vision, for hearing, smell, taste, and balance. So we also have to know about this. And it also allows breathing, swallowing, speech, facial expressions, and it supports and moves the head. It provides passage for blood vessels, nerves, air, food between the head and the rest of the body. So this is why it is very important for us to know this. So when you're talking about head and neck, you find that it is comprising of the head itself, which in which you have to know and look at the skull. We'll have to look at the brain. We'll have to look at the eyes. We'll look at the ears, the nose, the nasal cavity, the oral cavity, salivary gland. So basically everything that makes up the head. And we'll go to the neck region. So for the neck region, we'll have to talk about the cervical vertebrae, and we'll talk about the pharynx, the larynx, the trachea, the esophagus. All these are some of the structures that we're going to look at in the neck region. We'll also look at the thyroid gland, the parathyroid gland, the major blood vessels, the cranial and cervical nerves that make up the neck as well as the head. Okay. And we'll also look at some neck muscles. Okay. So, so that is basically everything that we're going to look at. So the anatomical divisions of this head and neck, you find that it is commonly divided into the scalp, the face, the cranium, the neck, the oral cavity, the nasal cavity, the orbits, the ear, the pharynx, and the larynx. Okay, so those are some of the things that we are going to talk about while we're looking at this topic. So today we are specifically going to talk a bit about the bony skeleton of the head, which we call as the skull. Okay, so the skull bone is what we're going to focus on in this subtopic. So you find that the skull is consists of 22 bones. Okay, just a bit. Okay, so I was talking about the skull bone. So this will be our main focus. And for the skull bone, you find that it consists of mainly 22 bones. That is excluding the bones that you find in the middle ear, which is the ear ossicles. So if we exclude the ear ossicles, the skull bone is specifically made of 22 bones. Okay, so except the mandible, which is the bone of the lower jaw. So where your lower teeth are located, you'll find that all the bones of the skull are joined together by sutures. Okay, and they are immobile and they form the cranium. So the only bone, which is the mandible, its attachment is not through these sutures, because sutures they are immobile, okay, as compared to how the mandible easily moves. So this skull bone is subdivided into two parts. It has an upper and a lower part. So the upper domed shaped part, which covers the cranial cavity containing the brain, is what we call as the cranial vault or the brain box or the calvaria. Those are all the names that we call the upper part that covers the brain. Okay, so it is attached to the skull base below. So the calvaria along with the skull base, we call this as the cranial skeleton or the cranium. Then we have the lower anterior part, which we call as the facial skeleton, which includes the mandible. So there is a picture here that is going to show us exactly what we're talking about. So you can see these bones. So the colored bones going up. So all these colored bones up here are what we are calling as the cranium or the cranial skeleton. So this part is what covers the brain. Then we have the facial skeleton, which makes up the face. This is the brown part right here. Okay, so we've said the skull is divided into these two parts. So what is the function of this skull bone? What is the function of this skull bone? Okay, so these are some of the functions. So you find that the skull provides a case for protection of the brain and its coverings, which is the meninges. And then it provides cavities for accommodation of organs of spatial senses such as sight, hearing, equilibration, smell, and taste. So you find that it houses all these. And it provides openings for the passage of air and food. And you find it also accommodates the teeth as well as the jaws for mastication. So it also helps in mastication. So remember, we talked about the skull bone having 22 bones. So now, what are these 22 bones that make up this skull bone? Okay. So we talked about the 22. So you'll find that out of these 22 bones that the skull has, the cranial has 8 bones, out of which 2 are paired and 4 are unpaired. Okay, so this is the cranial skeleton. Remember, we talked about the cranial skeleton and the facial skeleton. So the cranial skeleton has 8, while the facial skeleton has 4, in total 22. So this cranial skeleton has 2 paired and 4 unpaired. So the bones that are paired, we have the parietal bone and the temporal bone. Then the unpaired bones, we have the frontal bone, the occipital bone, the sphenoid, and the ethmoid bone. So these are the ones that are unpaired. Then for the facial bones that make up the face, we have 14. And out of these 14, 6 are paired and 2 are unpaired. So the paired 6 bones, we have the maxilla, the zygomatic, the nasal, the lacrimal, and the palatine. While the unpaired bones, we have the mandible and the vomer. So these are the bones of the skull. Okay, so what we're going to look at the joints of the skull that help in joining these bones. So the bones of the skull are united at immovable joints, like we said, which are called the sutures. The connective tissue uniting these bones are called sutural ligaments. Okay, so it also has sutural ligaments. So the exception to this rule, as we said, it is in the mandible, for it is connected to the cranium. Okay, it is connected to the cranium by a synovial temporomandibular joint, which are freely movable joints, unlike the sutures. Okay, so this is what we meant. So for the exterior part of the skull, there are certain terms that you find that the external features of the skull are studied from 5 different aspects, which we call, you can study the skull looking at it superiorly, okay, the superior aspect. You can study the skull looking at it posteriorly, anteriorly, and the lateral aspect or the inferior aspect. So depending on which part you are looking at the skull from. So if you are looking at it from the superior aspect, we call that as the normal verticalis, okay, the normal verticalis. Then if you're looking at it from the back, it is the norma occipitalis. Then for the anterior aspect, if you're looking at the skull from the anterior aspect, we call this as the norma frontalis. And then from the lateral aspect, we call this the norma lateralis. Okay, so is these are some of the different ways you can study the skull. We also have the normal basalis, which is from the inferior part of the skull. So now, if you're studying from the skull from the superior aspect, this is what we call the norma verticalis. So I want us to look at the superior aspect of the skull. So this is the superior aspect of the skull. So what do you get to see when you are looking at the skull from above? So you will see these 2 paired bones, which we call the parietal bones. Okay, so you have the left and the right parietal bones, and you can see that there are certain sutures. There are these lines. These lines that are dividing these bones are what we call as sutures. Okay, so we have this suture right here, which is in front. So this side is the front part. Then this front part, you can see this blue bone as this is the frontal bone. Then at the back, you can see this bone right here. This is the occipital bone that forms the back part of your head. Okay, so this is the occipital bone, the 2 parietal bones, and the frontal bone. Okay, so this is the superior aspect of the skull. What else do you see? We see these sutures around it. So we have what we call is the coronal suture. This is the coronal suture. Then the one that cuts it in the midline is what we call is the sagittal suture. Then we have the lambdoid suture, which cuts these 2 bones from this one bone that is at the back, the occipital bone. So this is the lambdoid suture. Okay. So now, this is the normal so we've talked about the normal verticalis. Then now we can talk about the norma occipitalis. So looking at the skull from behind, if we're studying the skull from behind, these are the structures that you can see. You see that the bone that forms the back part of your head is fully visible here, which is the occipital bone with the suture that divides it from the 2 parietal bones. So this is what we call as the lambdoid suture. Then we have the sagittal suture and 2 parietal bones right there. Then down here, you can also see that there is this bone down here, which is what we call the mandible. So this is the mandible, where you find that your lower teeth are attached. Then we have the upper part, which is the maxilla. Okay. Okay, so we can go to the next one. So for the next one, we have the anterior view of the skull bone. Okay, so this is the anterior view of the skull bone. So in this type, what things do we see? Okay, so in the front view, the skull will appear oval, being wider above and narrower below. And then the frontal region, you find that it's formed by the frontal bone, which is this bone right here. So we have the frontal bone, we have the orbital openings. So these are the orbital openings. So you find that each opening is present above and lateral to the anterior nasal aperture. So this is the nasal aperture. Then we have the superior orbital margin, also have the superior orbital margin. Okay, and then you can see some other prominent bones. So we have this bone right here, which is the maxilla, and here again you can see the mandible. You can see these two blue bones that are here. So these are the zygomatic bones. And then we have the little details in the orbital region, which is the lacrimal. We have the lacrimal bone. We have the ethmoid, palatine bone. Okay, so we have all those. Then we also have the sphenoid. So we can see there is a sphenoid bone right here. Okay, so this is very important for us to get to understand. So you have to understand the bones of the skull. So you have to when the skull bone is displayed like this, you have to be able to identify which part is being shown at which time. Okay. Then aside from this, we have the lateral view of the head. So in the lateral view of the head, what do we see? So you see bones and sutures in this lateral aspect. So we can see the frontal bone, the parietal, the occipital, the temporal, the sphenoid. We also have the zygomatic, which is this one here, the mandible, and the maxilla, as well as the nasal bone. You can see the nasal bone right there. Then you can also see sutures. Okay, so we have the coronal suture, which we said is this one. Okay, we have this coronal suture. We have the parietal squamous suture between this parietal and the squamous part of the temporal bone. So this is the parietal, the temporoparietal suture. Then we can also see the lambdoid suture, which separates the occipital bone from the parietal bone. Okay, so that's the lateral view or the lateral aspect of the skull. Not only that, we can also see the skull from down below here, which is the base, okay, the norma basalis. So in the norma basalis, you can see that from here, for the sake of convenience of study, you find that it's divided into three regions or parts. So you have the anterior, the middle, and the posterior. Okay, so these are by two imaginary transverse lines. So it's like you just put these two imaginary transverse line. So the anterior transverse line, which passes along the posterior free margin of the hard palate. So just this down here is the hard palate. So imagine passing down there. Then we have also the posterior transverse line, which passes along the anterior margin of the foramen magnum. So this part here is what we call as the foramen magnum. Okay, so you have that. So yeah, so all this these are some of the parts of the the basal part of the skull that you are going to see in the basal view. Okay, so aside from these views of the skull, you also have to know the skull of the newborn. So what is striking about the newborn is that the feature that is striking of the newborn skull is that it's huge. Okay, so the size of the newborn's head is huge relative, and it has a relatively small size of the facial skeleton. So you find that the facial skeleton is smaller as compared to the cranial skeleton. So in a newborn, you find that the facial skeleton, it forms about 1/7 of the cranium. The facial skeleton is small and it consists of tiny collections of bones clustered under the anterior part of the cranium, and the huge size of the cranium is due to the fast development of the brain, and the brain reaches 25% of its adult size at birth and 75% by the age of 4 years. Okay, so that is this about the frontal, the newborn, the skull of the newborn. Then aside from this, you find that in the newborn, there are things that we call as fontanelles. Okay, so the fontanelles are simply the bones of the, you find that the bones of the vault of the skull are ossified in membranes. Okay, so at birth, you find that it is partly ossified, and 6 unossified areas you are seen between the bones, which are called fontanelles. Okay, so in a newborn, you find that there are certain parts that are soft in their heads, like they are extremely soft. So those parts are what we refer to as fontanelles. So they are just these um, non-ossified parts in the skull of the newborn. So the fontanelles, they serve two important purposes, which is they permit some overlapping of the skull bones during childbirth. So when a baby is being born, they can overlap for the baby to be born easily. And it also permits growth of the brain. Okay, so it permits growth of the brain. So you find that there are 6 fontanelles at birth that are situated at the 4 angles of the parietal bones. 2 are therefore the median, which is the anterior and the posterior, and 4 are lateral ones. Okay, so they are found on each side, the sphenoid and the mastoid. So we have the anterior fontanelle, we have a posterior fontanelle, and we have a sphenoid as well as the mastoid fontanelles. So let me just display the skull of the newborn. Okay. So this is the skull of the newborn, and the fontanelles that we're talking about. So the front part, which is the anterior fontanelle, it is situated at the place where the 2 parietal bones you can see here and the 2 uh, halves of the frontal bone come close together. So this one is the largest diamond shape. So this is diamond shaped. Okay. So you can find a question coming asking you which fontanelle is diamond shaped. So it is the anterior fontanelle. Then we have the posterior fontanelle, which is back here. So the posterior fontanelle is situated at the junction of the sagittal and the lambdoids, which are just here. Okay, so that is where it is situated. So this one is it's triangular in shape. So this one is triangular in shape. Then we have the sphenoid and the mastoid fontanelles, which are situated at the sphenoid and mastoid angles of the parietal bone. Okay, so here, I don't know if we can, okay, so we have this mastoid fontanelle, so we can appreciate the mastoid fontanelle there, and we have the sphenoid fontanelle right there. Okay, so these ones, they are small and they are irregular. They do not really have a specific shape to them. Okay. So the anterior fontanelle is the largest and of great clinical importance. Okay, so that is about it. So the degree of tenseness of the membrane, you find that it gives an index of the intracranial pressure. Okay, so that is about these fontanelles. Okay, so you find that okay, so this is what we've simply talked about. So depending on the fontanelle that you are looking at, you find that each fontanelle closes at a specific time during child development. So the posterior fontanelle closes soon after birth. Okay, so it closes soon after birth. Then the lateral fontanelles, they'll close within a few weeks of birth, while the anterior fontanelle, it will close by the age of 2 years in a child. Okay, so you find that the anterior fontanelle, it takes a bit of time to close up. Okay, so this is about this. So we'll continue with our class soon.